So I'm working as an epidemiologist for the Jefferson County Public Health Service through the New York State Public Health Fellowship Corps program. My name is Ravi Kumar Chalhotra. I graduated with my Master's of Public Health and Epidemiology in May 2024. Jefferson County is a bit more of a rural region, so a lot of the challenges we face are around, access to healthcare and how we can best assist people to be as healthy as they can be in their limited, be it how much they can travel to the hospital and or doctor's offices. So as an epidemiologist, a lot of my work involves looking at data and trying to identify trends and then researching possible interventions that we can employ to best, meet the needs of the people in our county. I'm working as an epidemiologist, so really my Epi 1, 2, and 3 classes came into play. All of my stats classes came into play. And I worked to help create the Environmental Impact Analysis Lab with Dr. Caravanos, Dr. Erickson, and Rahul Kulkarni. And through that, I was able to work and improve on my GIS mapping skills, which is really one of the core foundations of what I'm being asked to do in my current position. So, for example, we look at lead, and when I get the data for lead, I then map out to see what the hotspot regions are for where children are being affected, and then going back to researching how that can be improved upon, and so they can improve their health outcomes. Another fun memory was running that environmental impact analysis lab, and we organized soil gathering trips, and then in rural Bronx and Queens, and then we would then analyze that soil to see what the lead concentrations and stuff were. Also, the APE program, and then working with Dr. Merjanoff through the APE program really helped because in that I was able to look at big data sets, cleaning up those data sets, and in the real world, a lot of the work you do is looking at those big data sets and cleaning them up so you can do data analysis and try to find and identify those trends. The strength of the program was that we had to do between your first and second year, you need to work on that, your APE, your applied practical experience. And during that time, you then look at, you work on real data. I did epidemiology, so it was what kind of gaps exist and what can be done to clean it up to make it workable. And then now that I'm working in the real world, a lot of the work comes down to cleaning up the data set because you don't get clean data sets really ever. And in order to work on them, you need to clean them up. You need to see what's missing. You need to see what can be added. I'll get data sets. I'll be like, okay, I don't remember exactly how I can clean this up, but I remember that I did something very similar back from my thesis. So then I'll go back to my old code that I wrote, look at it, and then modify it to hit the real world challenges in that real world data set that I'm looking at.